I'm Dr. Amanda, orthodontist at StraightSmile Solutions. We help dentists launch and scale orthodontics in their practice. Today, we'll be sharing some content from a webinar that was co-hosted with Ms. Tamara Thomas of Facial Physique Oral Myofunctional Therapy. To connect with Ms. Thomas, please use this QR code or visit www.facialphysique.com. If you want to help with an orthodontics case, please contact Dr. Amanda with @StraightSmile Solutions, www.straightsmilesolutions.com, or click on her QR code.
I was going to go over a little bit of bringing it into your office. So you can either refer out, which is what I have my own business doing this. I've been doing it for almost 6 years now. I've always been virtual. Even before COVID, I've been virtual. And I'm lucky enough to have figured out how to assess patients. I have a whole platform that I've built out for myself. It's HIPAA compliant. It's very user-friendly for the patients. And I see patients throughout the world. So I've made lots of connections with orthodontists, ear, nose, and throat physicians in different parts of the country and the world, and working a lot in the UK, actually, with a lot of myofunctional therapists even over there. But you can refer out or you can bring in. So some of us love to have our own business and others would prefer to work with somebody. The one main thing I'd like to caution is that it's not like bringing a hygienist on board. It's like a whole department. So hygienists and speech and language pathologists are able to take these courses. You have to be one of those in order to take, or dentist, I'm sorry, I should say that. Take these courses to become a myofunctional therapist. But where was I going with that?
You're talking about implementation in an office. Like it's not that smooth just to bring one in. It's not like hiring a regular staff.
Yes, it's not like hiring regular staff where you're going to bring us in and we can do a prophy cleaning and then the last 20 minutes we can give exercises. That's a little much. It's more like if you were to bring a speech and language pathologist into your practice to teach speech, you wouldn't do that in a hygiene setting too. It's just a little too much for that appointed time. So it would be good to have in your office. You just want to make sure that it's something that's separate from a hygiene appointment.
So how do you book it? If you do go into an office, how do they schedule it? What type of chair would you want? Like, how would that work?
So you don't need too many things for an assessment. We're taking photos, we're assessing function. So a sterilizer, definitely need that because you're going to be using teeth retractors, but you don't need a full-on dental chair with suctioning and water and all of that as well. So it's pretty minimal, the overhead, in the sense if it was just myofunctional therapy, you just need a room for the patient to be in, good lighting, mirrors. It's very simple that way. And then you would, for me, so I'll tell you how I do my virtual a little bit, because it would be the same as if you're in person. I see them online. I send over photos that they need to take and upload into my portal. The photos that they take aren't diagnosing anything. They're not, it's just a way to start. What I'm really assessing is function. So I want to see the way everything moves and if there's compensations. So that just gives us a baseline so we can see what they look like afterwards and the progress that they made. That usually is about an hour. Some therapists will do an hour and a half. It's very in-depth. We're going over sleep. We're going over from when they were an infant, did they breastfeed? If they couldn't breastfeed, why couldn't they breastfeed? So there's all these little red flags that go over where they are today. Then if they decide they want to move forward, then we do about 30-minute sessions. Some therapists like 45 minutes. Selena sometimes will do 45 because this is my associate Selena, because she's learning and I oversee her a little bit with all of that. As you get a little bit faster, a little bit should be good to do 30 minutes. I meet every 2 weeks. And then after there's 3 phases, right, of therapy. There's the intensive phase, which usually is about 4 sessions. The habituation phase, which is where we're getting rid of those old habits and giving those new ones. And then the retention phase. So they have to get through all of those phases usually to have it be successful. Usually about 12 sessions. it's usually 12 sessions or more. And I tell patients that only because they have to know how much of a commitment it is. You're eliminating a habit, and that takes a really long to eliminate that and get yourself a new one. If someone has obstructive sleep apnea, a lot of times that will be more if they're not compliant with doing the exercises as prescribed. They won't do well either, because every exercise we give is a building block. So if we meet and they haven't done the exercises, really just give the same ones until they get those down, and then we can move forward.
So do you like test them before they move on to the next step, or?
Yeah.
Oh, wow. That's so
Yeah.
cool.
Yep. So we have them do specific things. We explain to them what we're looking for, do this exercise, but we don't want you activating the patella. So look at yourself in the mirror, try to relax that the best you can. We're giving exercises. If they can't do it after so many sessions, then we know that there might be a restriction there that we need to refer out to a provider to evaluate that a little bit more.
I see. So if they can't get around it, then they might have to have a surgical release or something like that.
Yeah, and that's where either the dentist or the ear, nose, and throat physician, whoever is performing that release, comes into the integrative approach of everything.
Cool.
Yeah, so usually about 12 sessions. It's usually about at least 6 months of therapy, which seems like a really long time, but it does go by pretty fast. And then the end goal is to have those 4 goals, nasal breathing, lips closed, tongue on the roof of the mouth, and proper swallowing without pushing against the teeth at all, or using any muscles that are compensating. Anything else, Amanda? Any other questions about the way I do things? So putting that into like an actual place would be pretty similar.
Can you go over a little bit about, I think you mentioned briefly that you could be a dentist, a SLP, or a hygienist in order to become an OMT, but can you go over just real briefly, like what the classes are like? I know you told me about it, but just so we can share with our viewers how they could get maybe their hygienist in their office or the dentist certified.
Yeah, so you don't have to be certified. That's where it's kind of going. The field is going. It's not a licensed field. It's that you have a license before you move on to go into myofunctional therapy. And that license is either a hygiene license, an SLP license, a dentist. Some places are even letting PTs and OTs in. Just depends on where you go. So there's a lot. And I have a whole class that I've given for anybody that's wanting to explore this field and to see the different ways you can go. So there's the International Association of Orofacial Myology. That's the IAOM. That one, you have to be an SLP or a hygienist or a dentist in order to take that one. It does take a long time, and you get certified once you finish that one. I believe you have to take a 24-hour course, and then you have to have a test, an on-site test. You have to fly the instructor out to watch you.
Wow.
Yeah, and it's so many hours, and usually
Sounds
about
pretty legit.
You can be certified.
Wow. Okay.
So there's that.
And cost? What's the cost approximately?
That one, because you have to pay for the instructor to fly out usually. I'm not sure if that's the same with COVID. That might be a little changed now, but they may start to be coming out now that we're kind of a little out of the woods with that tiny bit. But you have to pay for the instructor to fly to you. You have to put the instructor up in a hotel. So those costs vary, right? But the 24-hour course that I was just saying you have to take before all that, I believe most classes are about 2,500, 2,500.
Okay. Seems pretty reasonable. Yeah.
Yeah. Same with the one I went through, was called MyoMentor. That used to only be open to hygienists. Now it's through the Breath Institute, which is that photo that I was showing you.
Right.
That one is a 12-week program, and it's all online. Her name is Sarah Hornsby. She's awesome. She was my mentor for many years. I was her associate for a little while there at the beginning, learned a ton of stuff from her. So yeah, that's 12 weeks. And that one I believe is 22 to 24 or 2,500 around there. That one's not certified, but it's a great education. The one that I went through, certified specialist in orofacial myology, was taught through a behavioral school back east. It's no longer available, and it's been taken out of there, and it's through Sandra Colson Institute, and she's located in Colorado. And that one also, I believe, was like an 8 or a 12-week course. I believe that one was $3,000. Again, she has a lot of knowledge. She's been doing it for over 40 years. So I really wanted to learn a lot from her. That's why I took that course. I wasn't too concerned about being the certified part because it's not really recognized per se yet. There's no standardization within each association there is, but not overall.
And there's no licensure within state. It's not like you have to apply through your DCCA or something like that at the moment, right?
No. So at the moment, yeah. So hygiene and myofunctional therapy wear different hats. So you need hygiene to get into myofunctional therapy, but you can practice.
So you're basically, you're working off your hygiene license, or you're working off your SLP license, or you're working off your dentist license.
Correct. Got it. Yeah. And but I'm not doing hygiene, if that makes sense.
Right. But you are, but you're licensed for that. So got it.
And then there was one more. So I went to the AOMT, Academy of Orofacial Myofunctional Therapy. And that's AOMT info.org, I believe. I can give you all this information.
Is there a place they can go to get this information, or is it on your website?
It's I have a link that I haven't put on the website yet. My website's being revamped, but I can provide that. I can send it.
You can either give it to me or they can contact you either way.
Yeah, I'll give it to you. And that one it used to be a 4-day course. I've taken that one as well. They didn't have certification at that time. Now it's a 12-week course, and they do have certification at the end. You take the 12-week course, and then you have to do a test, and then you have to apply for the certification. Then I believe even to keep the certification, it's similar with the IAOM, AOMT. You have to pay a yearly fee and do so many units in order to continue to have your certification with them.
Got it. And then I don't know if you're going to go over this, but billing, I know you and I talked about this, but I want to make sure everyone else knows. Billing insurance, does it happen? Does it not really happen? How do people pay for it? How do patients pay for it? Tell me a little bit more about how that works.
Sure. So the billing portion is pretty simple. I usually do fee for service. If they're in California, I usually will give a super bill, and that's because that's where my hygiene license does come into play. And since I'm licensed as a hygienist and my MPI is through there, that's why I only give it for then. But they do have to have, it's usually through medical insurance, right? So it's not through dental insurance. It's not a covered benefit. So it can be a little hairy. It can take a lot of time. And usually most patients don't even deal, I just tell them up front, this is how much it is. I usually have them pay for 12 sessions up front. If they want to do that, I give 10% off, or they can do 6 payments. And the reason why I do it that way is because I want them to know it's not a 1 or 2 session thing and you're going to be fixed. It takes a commitment. And then at the end, if they want that super bill, I can send it to them if they have a medical diagnosis for medical necessity. Otherwise, it's not usually a covered benefit because there's no documentation.
So they'd probably have to have an MD diagnose it, and then they would be the ones that could. So I mean, I know some dentists do medical billing, but it's a huge pain from what I've heard. So unless you're already doing medical billing, I think they have some agencies you can use for that.
Correct.
Yeah. And outsource it. Yeah. All right. That's really good to know. An approximate price point. I mean, you can talk about what you charge or what the average kind of fee is. I know probably California is a slightly different price than maybe some parts of the country, but just an estimate of what people charge per session.
So I charge, the package for 12 sessions, I do $2,400, 10% off if they pay in full, and so on. I've had there are some therapists that do per session, but they're finding that patients aren't staying as committed. So most I think are going through the package pricing. I would say I have some friends, myofunctional therapists in like Georgia, and they're more like 100, 150 a session, depending. The other thing is I do free 30-minute informational consultations. And that is just for them to get to know me and make sure that we're a good fit, and even see like, I've heard of this, what is this? Just to get an idea. And I can do a little mini assessment. And then I charge $99 for the full hour of consultation. And I've had other therapists say, oh my gosh, that's so cheap. That's so much work. I can't believe you charge so little. And I was like, well, most people don't know what it is. And I want them to understand how this can impact their health. So for me, it's fulfilling. I think most charge between $150 to $350 for their consultation. And then I've had some therapists, especially in California, that I know up to $6,000 for yeah.
Wow.
It's very broad. I would say I'm pretty average, especially not just California, because I've have patient or fellow myofunctional therapists in Nebraska, Utah, Georgia, and they're all about the same.
Well, just like orthodontics, we often give the full assessment treatment plan for free records. We don't always charge for that, or really low, but it's the right thing to do, giving the patient the information. From there, they can decide if they want treatment or not. So, we don't always make money off that, but I enjoy it. It's my favorite part of treatment. So
yeah,
that's good.
Perfect. Yeah, that's why I do the 30 minutes, just so they don't feel like they're committed financially. And because a lot of them, like I said, just go, what is your specialty? I don't even know how to say it.
Yeah. Got it. So are most of the doctors that bring you in, do some patients find you and then you just work with them out and there's no like doctor referral, or most of the time do doctors bring you in for a particular patient?
So usually doctors bring me in, but I've had people like across the United States somehow found me. So they're not particularly referred from a dentist or any physician. They have knowledge, but then I always reach out to their physicians and dentists.
Oh, that's good. Okay.
Because
that's really good.
Like I said, it's a team approach. I don't do orthodontics, and that's a lot of things necessary, right? Or in some cases, and then obviously an ear, nose, and throat physician, if there's something going on with the nose. I'm just working with the muscles, but the muscles aren't individualized either. They're connected to a body. And there's a reason why they're not working properly, and we got to figure out why, and I got to find those specialties so the patient can be best supported.
So speaking of orthodontics, since you brought that up and everyone knows I am an orthodontist, I just had a consultation session with one of my doctors about an hour or two ago. He was showing me this open bite patient that he had. I was looking at it and I go, oh, there's some type of habit. Look at the face, look at this, look at that, and I said, I would not treat this patient, is what I told him, unless they were doing some type of, first of all, we got to find the root cause. Everything you were saying is what I said. And he's like, what? I didn't know about this, So, and I said, it is going to, even if you can, he goes, well, I know I can close this with brackets, it'll close. I said, but will it stay? Because I've seen them relapse so many times. I said, you don't know, so how would that work if you were trying to implement it? Let's say you had that kind of mild to moderate open bite patient. We know we need something like OMT to come in. Would they do it before they started the ortho? Is it during the ortho? How do you kind of integrate that?
So some patients will come to me where they're already in ortho. So, and everybody's so different. So if it's the only time I really will wait for myofunctional therapy is if there's a palatal expander, because we can't get that tongue to the roof of the mouth.
Got it.
It hits the tongue, right? So
what if it's a removable palatal expander?
And how long? It depends on how long they'd have to wear it, which is often, correct?
Oh, 24 hours a day for 6 months. Yeah.
So even though they can remove it, they still can't get contact.
Yeah. Because there's a thickness to it. So, okay. So better to wait till the expansion is done before you start that. But otherwise, as long as there's no appliance on the roof of the mouth, you should be good to go. So they can start at any time, or do you want to hit so many sessions before they actually start their ortho, or does it really not matter?
Usually doesn't matter in that sense. If there's no expander, then we just want to make sure myofunctional therapy and all those compensations are done before ortho comes off, right? Because we don't want that thrusting or any other issues that they're having to relapse.
Got it. Awesome. That was just super, super helpful. Thank you so much, Tamara, for all that information. Anything else that you wanted to add for doctors out there? They can contact you through the email, through the website, anything like that. Didn't know if you had any other last minute thoughts.
No, they can contact me at tamara@facialphysique.com. Selena's my associate. She's been with me for a couple of years now. She's been doing excellent. And then the QR code goes to facialphysique.com. There'll be more information up there. Right now, it's my older website, but I'm revamping it. A lot of more resources on there for doctors and hygienists and patients. So.
Perfect. Thank you so much, Tamara, for meeting with us today. Really appreciate it. You guys should definitely reach out to her if you have any questions. Thank you.
Thanks.